Hey, what's up YouTube? I'm coming to you with my second video. I apologize for it taking a little bit of time, but as I told you before, I'm a nurse, I'm a mom, I'm planning a move to Florida, so it's kind of been a little hectic. I've actually been picking up a little bit extra at work, but I definitely wanted to bring you guys some more content. So this is not going to be like my last haul, which was a Shein, or my last video, I should say, which was a Shein haul. I'm actually going to talk to you about nursing. So just to give you guys a little bit of background, I am a registered nurse. I graduated in May of 2020. I started my new job in August as a staff nurse on a specialty med-surg unit. So I'm an ortho neuro spine nurse. So I deal with patients that have hip surgeries, really joint surgeries in general. So hips, knees, backs, things such as strokes. So any sort of neurological deficit. I have about 10, 11 months at this point. So I kind of wanted to bring you guys a video that talked about some of the things that I carry with me. I think as new nurses, you assume that you have to have kind of the latest, the greatest, and just like so many different things. You try to scour the internet for videos to tell you the things that people feel like you should have. Obviously, each nurse is going to kind of cater, what they bring and what they feel like is important based on, their workflow and how they work. But I just kind of want to tell you some of the things that work for me and some of the things that I like. So obviously, I have my work badge. I'm masking out the location, obviously just for privacy, but it just obviously has my name badge. I got this actually from my preceptor once I got done with training and orientation, so that was super cute. So that you can customize, as to what you want. A lot of jobs will give you a badge that says, whatever hospital you work at, but you're definitely more than welcome to kind of show a little personality and customize this in your own little way. And it has your little RN title. I would say almost every hospital is going to do that. Another thing that I have is my Vocera. This is hospital distributed. I don't know if every hospital necessarily uses this specific system, but your hospital will more than likely use something to this extent. It's just a way for you to be able to communicate with people and for people to be able to communicate with you. So since I work day shift, I'm working with occupational therapy, physical therapy, speech therapy, physician's assistants, nurse practitioners, hospitalists, orthopedic doctors, cardiologists. So all the different specialties, urology, any sort of people that could be working with my patient, in addition to my charge nurse, I'm trying to think of dietary, your techs. So anyone at this point can pretty much reach you once you log into the system, and you can reach other people. So it's really convenient. If you're in a room, you need help, they need help, this is going to be obviously your best friend. So this is generally something the hospital is going to give you. Another thing I have is my Apple Watch. You obviously don't need an Apple Watch, but I like mine. It obviously tells my time. I set it to the 24 hours, so I'm able to, if you're not accustomed to military time, which I was not prior to working at the hospital, it definitely keeps you on track, and you can mark everything in military time and look at your watch and be able to, read the time the way it is in that 24-hour military time frame. In addition to that, you can change your watch faces. So you can do like a time, like a second hand. So that way, if your hospital doesn't have a clock, or sometimes they don't always work the way they should, then you can definitely look at your Apple Watch and you can change your face to where it kind of has that stopwatch or the second hand, so you can do your various vitals and what have you. And as far as my uniform goes, I have a little kind of side pocket here. So I definitely like the scrubs that have, I don't know if you guys can see, the little cargo side pocket. One of the things that I carry, are gonna be these normal saline flushes. Everybody that knows, you flush your patient's IVs when you saline lock them off in between various IV medications, and just to make sure that your patient's IV remains open and usable in between things that they have going in their IV, because they don't always have continuous fluids going. So I like to kind of keep these in my pocket. I put them in this little side. Hopefully you guys can see that. So that way they're readily available for me to whip out, you know, whenever I need them. So another thing that I carry in my pocket is going to be pens. Pens are going to be your best friend. A lot of times the good thing is the units will keep extra pens. I honestly don't really invest in good pens. I used to, but I find you lose them, you leave them, you borrow them, what have you. And I just don't want to really invest the money for something I'm going to lose. So I just kind of carry the basic, just black pens. It works for me. I kind of try to make sure I have two, because usually at some point throughout the day, I'm going to lose at least one of them. Not always, but most of the time I do. Another thing I keep in my pocket is a pair of scissors. You will use these scissors multiple times a day. I use them to cut various pill packages, whether it be open or separate them inside the Pyxis. And the Pyxis is the machine that you pull the medications out of. So a lot of times they don't always cut on the perforated edges, sorry. So these are gonna be your best friend when it comes to that kind of stuff. In addition to cutting, bandages, you just never know what you'll need some scissors for. So I would definitely invest in a good pair. These are actually some trauma shears that I got probably from Amazon, so you can pretty much find them. Just get a good pair. You want ones that definitely cut. These are Prestige Medical, and I like these. They came with two different sizes, like a bigger one and the smaller one. I like the smaller one because I can just kind of keep it in my pocket and I can use it for pretty much everything I need. What else do I have in here? Let's see. Chapstick. As nurses, especially now with COVID, you wear a mask all the time. Your lips are very dry. You talk all the time to your patient, to your patient's family, to doctors, and like I said, all the other staff that I named. So your lips are gonna get dry. You definitely wanna have some good chapstick in your pocket to make sure that the corners of your mouth don't get, you know, I don't even wanna say messed up, but just kind of start cracking at the corners or just having chapped lips. So make sure that you take a good chapstick with you. I think that's pretty much it for what I carry in my pocket. I'm gonna do another video. I actually do make a little sticky note every day that kind of details some of the things as far as my patient's medications. I'm working on trying to create a template that will help nurses as far as knowing whether your patients are on fluids, what narcotics they're on, if they have blood sugars, what time certain stroke scales are, and different things like that. And it just helps me with my flow when it comes to passing medications. So just wait for that. I'm definitely gonna try to get that out in addition to my brain, my nursing report sheet. I use my own. Some hospitals will have their nurses use all the same one, and they keep kind of making copies with updates and passing them on to the next shift. Not every hospital does that. So I would definitely recommend, if you're in nursing school, that would be the number one tip that I would give you, is to definitely try to find a nursing report sheet that you like. So that way you start to get familiar with where things are as far as if the patient's on room air, if they're alert and oriented. Because if you start to know where those boxes are, whether you have a nurse that gives super slow report or one that gives report at a crazy speed, it's easier for you to write all those things down and not miss any key points, or not have to keep asking them to repeat certain things, because you already know where those boxes are. So I'm very familiar with my sheet. I know where everything is. If someone asks me, a doctor, a nurse, report time, what have you, I can spit off things because I'm familiar with my sheet and I like it, I use it, and it works for me. So that's another thing I'm trying to roll out. If you don't have a report sheet, so maybe I can do like a downloadable option on Etsy, so that way you guys can, you know, get access to that. So in my other pocket, I carry alcohol. So alcohol, you use it all day long. So you're gonna use it to scrub the little hubs when it comes to your IV ports. You use it for blood sugars, you use them for insulin, your Lovenox, heparin, pretty much all day long. So I just keep a little stack of alcohol in my pocket and I have it readily available. The thing is, you want to try to make as less trips as you can to the supply room or the med room just getting the basics that you know that you're going to need every day. And that's really all that I keep in my pocket. You don't want to inundate yourself with too many things. You don't want to keep track of too many things. You don't want things falling out of your pocket, or you don't want to lose things. So these are the things that literally I have every day, and I feel like they get me through my day. And sometimes people even ask me, do you have a flush? And I'm able to pull one out of my pocket. So less is more, I feel like. And if you kind of get in the routine of having those essential things, you can grab the things that you don't necessarily use on a day-to-day basis. I know some nurses will kind of have, what do you call them? The little caps, the alcohol caps that you have for patients that have central lines and different things like that. I don't feel a need to have that linked to me on a day-to-day basis because I don't always have a patient that has a central line. I mean, I may every now and again, I just don't feel like that's an essential for me. If I have someone with a central line, then generally I'll have those supplies hooked to their IV pole, and then I'm able to utilize it for that specific patient in that patient's room. So again, I feel like less is more. You guys will figure that out as a nurse, and I'm gonna come to you guys with a couple different nursing videos. If you guys can definitely like, subscribe, share, comment down below and let me know maybe some of the things you'd like to, hear as far as nursing goes, whether it be nursing school, the NCLEX. I want to come to you guys with a video about prioritization and just some of the things I would give as far as tips and tricks for new nurses, because I think as a new nurse, you're terrified. I definitely understand that. But you're definitely going to make it. You're going to get it. You're going to create your own flow. And hopefully you start a job that there's some awesome nurses, because I definitely don't feel like nurses eat their young. I mean, luckily for me, I started somewhere that the nurses were awesome, definitely helpful, and, wanted me to succeed. So I feel like as a new nurse, a lot of people don't even know I'm a new nurse. So luckily for me, I was able to kind of get in and get the experience, be confident. But nursing is my second career. Prior to nursing, I was a manager of a dermatology practice. So I've been in a customer service driven environment. I'm used to talking to people. I'm comfortable talking to people. So I think that's half the battle, is just having that confidence, knowing that you don't know everything. School is definitely just the tip of the iceberg. Give yourself an opportunity. Know that it's okay to not know everything, but just being prepared. I think if you're prepared in the way for your day, you have your uniform, you have all the supplies you need on a day-to-day basis in your pocket, then, those things that come later, are gonna be things that you're gonna learn. But being prepared just in these small little things are gonna get you through your day, and you're gonna learn as you go. So I think my next video will be on prioritization, maybe even just kind of tips and tricks for new nurses, maybe even what's in my nursing bags. I do take a nursing bag with me to work every day, even though I do have a locker at work. I just feel like it helps me be a little bit more prepared for my day. So I thank you guys for tuning in. And again, please comment, like, subscribe, share. And if you guys have any suggestions for another video, please let me know. I'm also trying to work on another haul, maybe like a shoe, like a shoe haul of some sort. I've been trying to get into some of the trendier shoes that I see, the sandals and kind of girly things for the season. So, well, if you guys made it to the end of the video, you guys will realize that I forgot probably one of the most important things as a nurse, and one thing you're definitely obviously gonna need every single day, and that is gonna be your stethoscope. That's probably why I forgot that part, because obviously it's kind of a given. I mean, you definitely need a stethoscope. I have the Littman, I wanna say the classic, what does it say on here? I don't know if I think it's the Classic 3, yep. So the Littman Classic 3, but I actually purchased the Echo core attachment. This is like the newest one. I wanna say it was probably like $199. It's just an acoustic piece, a digital, it makes it like an electronic digital stethoscope. I don't use it with the like Bluetooth phone capability, like to record different sounds and all of that. I just found that it was harder for me as a new nurse to be able to hear all the various heart sounds and different things like that. But you can actually turn this on, you can adjust the settings, and I can go into that obviously in a whole nother video, but Your stethoscope is definitely something you're going to need for your assessments on a day-to-day basis, to listen to heart sounds, lung sounds. So all the things I mentioned in addition to your stethoscope will definitely be needed. So another thing I take with me is going to be my clipboard. This is a white coat clipboard. I want to say it was probably like $35. I probably bought it specifically from the company. You probably can buy maybe some bootleg versions. I don't know, but I got mine from the actual company. So it was like $35, $45. It is kind of expensive. It's supposed to fit in your pocket. I don't carry it in my pocket, but I do bring it to work in my book bag. I keep my report sheets. I keep sheets that I use to do our rounds with, and that's kind of a whole nother conversation. But when I get with various disciplines, they want to know different things about your patient, so that way we can get a patient ready for discharge. So I keep that. Anything that I want as far as policies, procedures, any quick things, I keep in this clipboard. So I take this to work with me every single day. So thank you guys for sticking around for this entire video. If you did, I really appreciate it. And again, just comment down below if there's anything else you guys would like to see, any content. I would be happy to kind of dive into that and share it with you guys. Thank you.